All right, so today we're talking about best practice strategies to prevent and de-escalate problem behaviors. Some of the parts of this training will be from CPI, which is Crisis Prevention Institute. So some of you that have been previously trained through EHT, from the trainers that we have here, some of this might be familiar. Some of you may not have yet received your CPI training, and that's okay. This will be new to some of you, but you'll also be hearing it later because we will be getting back to those CPI trainings. But today is not going to include any of the physical or restrictive interventions. We're just going to be talking about some of those non-restrictive interventions. So things that we can do prior to reaching a crisis level behavior. With, again, that idea of preventing or de-escalating those behaviors before they reach crisis level. So our ultimate goal is to provide an environment where everybody feels safe, secure, and respected. So that includes our students as well as all of us as staff members. Safety is our first priority at all times, again, for our students and all of our staff. So now this is from CPI. And we're just going to start off by talking about behavior as a form of communication. And when I talk about behavior, I mean all behavior, whether it's a desirable behavior, like raising your hand, asking for a break, signing that you want a cookie, exchanging a Pets icon, that you want an iPad. All behavior is a form of communication, which would then also include some of our undesired behavior. So maybe hitting, yelling, falling to the floor. That type of behavior is also a form of communication. So that is really important to remember when we're working with our learners, that the good stuff that we're seeing, as well as some of the challenging stuff that we're seeing, our learners are trying to communicate with us. And it's up to our teams, sometimes, especially with some of those less desirable behaviors, to figure out what the function of those behaviors are, so we can turn those behaviors into more functional behaviors or more appropriate behaviors to communicate the same thing in a more desirable way. So here are the CPI values that go oftentimes very hand in hand with the values that we have here at EHT: care, welfare, safety, and security. Again, we already said that one of our first priorities is the safety for our staff and for our students. We want everyone to feel safe and secure when they are here at school. Care, this one is really important. We want to treat all of our students, as well as all of our staff, with the dignity and respect that they deserve. And we want to make sure that we're looking out for their welfare, their quality of life, their well-being at all times. And some of the strategies that we talk about today are really focusing on these values and philosophy. So the first thing that we're going to review here is the CPI Crisis Development Model. So on the left here, we have 4 different levels of crisis development or behavior levels that we might see a student demonstrating. And on the right, we have our staff attitudes and approaches. And at the top, you see a little arrow going both ways called the integrated experience. And this is because the behavior levels go hand in hand with that same staff attitude and approach. And so we should be changing our behavior based on our learners' behaviors. So we're going to talk a little bit about each of these. So our first level is anxiety, which is a change in our learners' typical behavior. And as a behavior analyst, I like talking less about general unobservable terms like anxiety, and I like making it or talking about it in terms of behaviors that I can observe. So this might include something like pacing, clenching your fists, withdrawal. And depending on your learner and how well you know them, this might mean that maybe they start talking more softly. Maybe they start talking more loudly. Maybe they start talking faster or slower. But something that is a change in their typical behavior that starts alerting to you that something might be bothering them, or they may have experienced some sort of trigger. So at this point, at this anxiety level, again, we've seen that change in behavior. We want to be taking a supportive approach. So an empathetic, non-judgmental approach. So we don't want to just dismiss the behaviors that our learner is showing us, or even dismiss if they try to express their feelings to us. We want to recognize those, and we want to we want to hear what they're saying, and we want to validate how they're feeling so that we're demonstrating a level of support. That next level is defensive. So at this level, our learner might be protecting themselves from a real or even a perceived challenge. At the defensive level, we might see our learners engaging in behaviors like refusal, shouting or yelling, belligerence. And at this level, our behavior is going to begin to change. So at this level, we might become more directive. We're going to provide clear direction or instruction. And in just a little bit, I'm going to talk a little bit more about what that should look like as well. Some of the tidbits of talking less at this point, not providing multiple directions, going just one at a time, maybe using even visual cues here, limit setting if we need to. But at this point, our learners might be losing rationality, starting to challenge authority, and so we want to make it very clear what we are expecting of them. At the level of risk behavior, level 3, now our learner is presenting an imminent or immediate risk to self or others. So this would also be what I would call crisis level behavior. So at this point, our learner might be engaging in hitting behavior. They might be engaging in property destruction. They might be engaging in self-injury. So our behavior would also change in that, again, integrated experience, and our approach might change to safety interventions. So this could be non-restrictive interventions, some of which we're going to be talking about today, or it might be restrictive interventions that would maximize safety and minimize harm. I just want to take a quick moment to talk about each of these. So non-restrictive interventions might include effective verbal interventions, again, which we're going to speak more about here today, making the environment safe, so possibly moving things around so the learner does not get hurt, hurt others or engage in property destruction, or maybe moving to a place of safety if the learner might is in distress and might engage in a behavior that could hurt themselves or others. Restrictive interventions or restrictive strategies are any physical, chemical, environmental, or mechanical intervention used to restrict a person's liberty of movement. Restrictive interventions, again, are not in the scope of today's training. They should only be implemented by people who have been CPI trained. And if they are implemented, they need to be documented immediately afterwards. So there's a document or form that you will fill out. The person should also be observed by the nurse. The nurse fills out part of that document. And that document needs to be sent home to the family and also shared with the team here at school within 24 hours. So these restrictive interventions are our last line of intervention, our most restrictive intervention in all the different things, in all the different strategies that we have in our toolbox. And because, again, we are restricting that person's liberty of movement, it is a decision that we do not take lightly because, again, we're making sure that we're treating our learners with respect and treating them with dignity, but also keeping them safe. And again, we must make sure that these are done only by CPI trained staff. And that when they are performed, they are documented immediately and all the appropriate people are notified. So then our last level here occurs, this could occur after levels 1, 2, or 3, is the tension reduction. So after that learner maybe goes through that anxiety, defensive, or risk behavior level, they would engage in tension or they would experience tension reduction in which there's a decrease in their physical and emotional energy. So examples of physical examples of this might look like their posture relaxes, maybe their heart rate or breathing rate start to decrease, maybe their face goes from being beet red back to being their normal baseline color. You might see some reduced muscle tension. Emotional examples could include maybe they're apologizing, maybe they are withdrawn, they become sad, some learners might cry, they might show even remorse or embarrassment. And so again, at this level, our behavior would also change. And we want to make sure that we are reestablishing a relationship with the learner. We're going to talk about this in a second, but crisis level behaviors are not personal. This is not a time that we should be talking about necessarily all the things that the learner did wrong or how, we're angry or sad about them. But this is where we're just reestablishing a relationship, making the learner feel safe, making the learner feel respected, letting them know that, we're here, we're still working together, and getting them right back into, the relationship that you had prior and getting back to their normal routine as quickly as possible. So before we move on in some of our CPI model, I just wanted to talk quickly about tantrum versus crisis behavior. So tantrum and crisis behaviors might topographically look very, very similar. So a tantrum and a crisis could both look like a student hitting. Tantrum and crisis could both look like a student dropping to the floor. Tantrum and crisis could both look like a student tearing paper and throwing it. But there are some differences in the intensity of the emotion that the learner is experiencing, as well as the duration of the behavior, as well as some of these nuances, which we're going to discuss now. So the first is that typically in a tantrum behavior, the learner may be aware of or watch other people's reactions. So you might see them looking at you often. You might even see that might seem like possibly it's the function of the behavior. Whereas in a crisis level behavior, the student has gotten to a point that they are no longer aware of others' reactions. Also in a tantrum level behavior, a student is generally still aware of their general safety and will avoid the risk of getting hurt. So maybe if a learner is on a table, they'll generally try to avoid falling off of it. Whereas if a student has reached that crisis level of behavior, they might not anymore have concern or awareness of their safety or the safety of others. With a tantrum level behavior, generally the behavior can be turned on or off a little bit more easily, so the behavior is under the learner's control. So for example, if a learner might be engaging in a tantrum behavior in order to get access to computer time, as soon as the student gets that access, the behavior is done. Or if the learner is trying to engage in behavior to get out of math class, as soon as the math worksheet is removed, the behavior is done. So it's much easier for the learner to turn those behaviors on or off. And once they access what they were looking for, the behavior typically ends, or once they met their goal. That does not mean that the correct strategy is to give them access to what they are looking for in order to end the tantrum, but it just means that there's still a very clear function of that behavior. Whereas in a crisis level behavior, once the student reaches that precipice of crisis, they don't really appear to any longer be in control of their behaviors, and it may take some time for that learner to de-escalate or to calm down, and that could be minutes or even hours. So again, we're looking at that intensity of emotion and the duration of the behavior to discriminate between a tantrum versus a crisis behavior. So again, they may look very similar, but that there's going to be a difference in that intensity and duration. Also, once your student reaches a crisis level, so the greater the intensity and duration of the behavior, the less likely the student's going to be able to respond to or learn from what you are doing or saying in that moment. We're going to talk a lot more about that in the next couple minutes. So this next slide, and the slide following this, is just a little visual, again, of that difference between tantrum and crisis level behavior. So if you look here at this blue line, this would be more of a tantrum level behavior. So as you can see, the intensity is a little bit less, even the duration of the behavior itself is a little bit shorter. Whereas in a crisis level behavior, you have this much greater intensity, and you also have a longer duration of the behavior. So this darker line would be our crisis level behavior, whereas this blue line would be our tantrum level behavior. So if we're looking at this bell curve here, we're looking at our levels, which very, very roughly correspond to some of the levels from CPI's crisis development model. Our level 1 is our baseline level of arousal that most of us and our students operate in a day-to-day basis. So at this level 1, this is when we should be working to teach different replacement skills. So teachers, this would be the time that you would be working on skills that are in the IEP system, that social, emotional, behavioral section. Staff, this might look for you guys like behaviors like taking deep breaths, asking for a break, asking when questions, things like that. So at level 1, this is when we're working to putting strategies in place that are going to prevent problem behaviors and or teach new skills. So again, all behavior is communication. So we are looking to teach those desirable behaviors that would replace the communication that our learners are trying to engage in with those undesirable behaviors. In level 2, again, here we have the learner going up that bell curve. So maybe they're hitting that anxiety level from the crisis development model. This is when we're going to try to redirect and refocus. This might be where we start to practice the skills that we taught in level 1. So now I'm seeing my learners start to engage in some anxious behavior. So maybe I start to see them pacing. Maybe I start to see that the coloring in their face changes. This is when I might prompt them to take that break that I taught them already how to teach or how to ask for in level 1. When we're getting up to level 3, this might be that defensive level. So maybe here our learner is starting to yell. Maybe they're starting to engage in some refusal. So I might have to temporarily remove the trigger and redirect. We're going to talk a little bit more about that in some of our future slides. But now you see here, here's this line. Here's that precipice that I talked about before. So once we get here into this level 4 and 5, this is when our learners are getting into that crisis level of behavior. So our goal is to de-escalate them with strategies that we're going to talk about next in levels 1, 2, or 3. Because in that level 4 and 5, our learners are no longer in an emotional state. Their level of arousal is so high that they're not going to be able to respond to our typical behavior interventions. And I always like to just use myself as an example. When I am extremely anxious or when I'm extremely frustrated and I've hit a certain level, I am not really able to be responsive to what other people are telling me. So either, I've just shut everything out. Maybe I feel like I'm seeing red. Maybe anything someone says to me, even if it's the most logical answer to a problem, my first response is no, that won't work. So this is not a time to try to talk to somebody. This is not a time to try to teach a new strategy. So that might be when we have to look at that crisis intervention or those restrictive interventions in order to help the learner stay safe. We'll talk a little bit more about that in a second too. This might be a time where we're starting to look at ourselves, staying calm, modeling being calm, practicing our stance. So within CPI, they talk about a stance where you kind of have your body off to the side, which is for safety reasons, but it's also to make yourself non-confrontational. If you are, directly engaged with the learner, that might be seen as confrontational. So we want to make sure that we have a non-confrontational stance, also protecting ourselves. We don't have our arms crossed. We have them down at our sides, things like that. But again, at this level 4 and 5, this is not when we're going to be able to teach our learners something new. This is not when a lot of our typical interventions would be successful because they've reached that level of arousal beyond that. So we can use our strategies at levels 1, 2, and 3. We should be having a high level of focus of teaching these behaviors and strategies at level 1, and then practicing them at levels 2 and 3 with the intention of de-escalating back down to that level 1. All right, so here are some things that I find are extremely important. And this first one is your approach changes everything. And I said this in the prior 2 trainings that I did this afternoon, but I think that this training especially is really fitting for today because, as many of you know, is in Dr. Grutrio's newsletter to everybody, today marks just about the 1-year anniversary of, schools closing and, our lives changing. So a lot of us are probably still experiencing a lot of anxiety or frustration over things still not being back to normal. And that could cause some of our approaches to things in the workplace to be, less than optimal. So it's so important that every morning when we come to work that we remember that our approach changes everything. So our approach to things in the classroom is going to impact our learners' level of success. And as well as any challenging behaviors that we might see our learners demonstrate. So really super, super important one. Your approach changes everything, and recognizing and understanding underlying causes of behavior of someone else as well as yourself can help you to respond and prevent and manage crisis situations. So this next one is also really important. Behavior influences behavior. So our attitudes and behaviors can influence somebody in crisis and vice versa. Somebody in crisis can influence our attitudes and behaviors, but it's up to us to be aware of our attitudes and behaviors, to be aware of our perceptions, and remain in control of ourselves in order to increase the likelihood of implementing a successful intervention, which is sometimes easier said than done. A lot of times, or most of the time, we probably think first with our emotional brain. But it's really important to stop, think, and let those emotions be taken over by our thinking brain. So behavior influences behavior. And it's really important in these situations of challenging behavior for us to be able to practice certain strategies to keep ourselves calm, to keep ourselves behaving consistently, and to demonstrate self-control and professionalism in these situations. So we're going to talk about this in terms of ourselves as adults and professionals first, and then we're going to talk about it in terms of our students. So there might be factors in your day that might negatively impact your ability to remain calm and consistent in a crisis situation or even in a tantrum behavior situation. So maybe you woke up late, you didn't have your cup of coffee, you got in traffic and on the way to work, or you're having family problems or an interpersonal conflict at work. These things might color your day and impact your ability to respond your best. So it's very important for us to be able to self-monitor those things. And remember, your approach changes everything. So sometimes it's really just necessary for us to leave that at the door, make sure that we have our best head on when we are working with our students so that we are setting them up for success. If we're in a level of arousal that impacts our ability to remain consistent and calm, that's going to also impact their ability to be successful as we're practicing some of these strategies. With that same thing, our students might also experience precipitating factors that influence their behavior. So precipitating factors is the terminology from CPI. Some of you may have also heard previously the term setting events, which is what this same concept is called within applied behavior analysis. So these are things that may not have occurred immediately preceding the behavior, but may have occurred in more the distal past, but that affects the behaviors that occur today and are very similar to some of the factors that we saw in the last slide. So maybe a learner didn't sleep well last night. Maybe they missed their breakfast. Maybe they wanted to wear a different pair of shoes and they couldn't wear it today. So these all could be things that have their level of arousal just a little bit off for the day. Sometimes we might know these precipitating factors. Maybe mom or dad gave us a heads up. Oh, we didn't sleep very well last night, so we can know, okay, we just got to be on our toes today. Or it might tell us that we have to implement certain strategies to have our learner be the most successful they can be. But understanding precipitating factors can also help you to avoid becoming a precipitating factor yourself. So many of our learners come to us with past experience, trauma, other things that might trigger a certain reaction from them. So I have previously given an example in which I had a learner who had a negative experience with somebody that wore glasses. And so if I put my glasses on, that was a trigger for them. But knowing that precipitating factor was able to allow me to manage my behaviors and put certain strategies in place for that learner to address those factors and overcome those challenges. But it was really helpful in understanding that trigger. It's also very helpful sometimes to understand these precipitating factors so that we don't take a crisis personally. A lot of these behaviors most of them don't have anything to do with us. And just like we all have really good days and really bad days, so do our learners. So I know that it can be really easy if you've had a challenging day to say, oh, I'm not good at this, or this learner really doesn't like me. But it's really important for us not to take the crisis personally, because that could color our relationship with that student as well. And we want to make sure that, we realize everybody has good days and bad days, and maybe not even thinking of it as good days and bad days, today was a harder day, today was an easier day, but not taking those things personally. Which brings us to this next concept from CPI, rational detachment. So this is something for us, especially as special education staff, to recognize the need to remain professional by managing our own behavior and attitude. In the past, this was actually with a former principal that I had worked with. She was talking to me about her granddaughter who had thrown a tantrum in a dressing room over the weekend. And she said, Jen, I didn't know what to do. What do you think I should have done? And it was a little bit as a joke, but a little bit serious. But I handed her a rule card that I had used with some of my students in the past. And it said, take 3 deep breaths and count to 10. And she's like, oh, I should use it with my granddaughter? And I said, No, you should use it with yourself. And I think that's something so important for us to remember sometimes as professionals. Again, our approach changes everything. Behavior influences behavior. If we're in a challenging situation with a student and we allow our own feelings and emotions to escalate, that's going to influence our student, and it's going to cause their behaviors and feelings to escalate as well. So it's so important for us to, self-monitor, and in those moments, remember that we need to remain professional. We need to remain consistent in our expectations and in our behaviors, and we need to remain calm. So it's so important for us to self-monitor and manage our own behavior and attitude. So as part of rational detachment, sometimes we might be looking at how's the other person communicating in those desirable and functional and appropriate ways, as well as those undesirable or more challenging ways. How are we responding? What am I expressing or conveying? Another time that, again, we should take a step back and monitor our stance. Are we full on or way to the side? Do we have our arms crossed? What does our face look like? So making sure that we're non-confrontational. How are they responding to me? We want to make sure that we're not reacting in a negative or a counterproductive way. So we have to be aware of precipitating factors that might be affecting us or impacting us, helping our thinking brain, keep our emotional brain in check, and mentally prepare so that we can remain consistent and calm in our responses to challenging behaviors. So here, this is very similar to that rule card that I share with my principal, but I think this is just a great one for us all to always remember when we're experiencing some of those more challenging behaviors with our students. And this is for us. Take a deep breath, choose our words carefully, ask for help if you need it. So again, behavior influences behavior. Your approach changes everything. So remember that this concept of rational detachment, stay calm, stay consistent, and self-monitor. So in all of our students, they're like an iceberg. This is a common analogy. About 10% of maybe some of those precipitating factors are known, or maybe they've been able to express to us, but there's lots of things that are unknown. So it's really important for us to just remember to alter our approach when we're considering somebody's precipitating factors if we know them, but also just know that we don't know everything. So acknowledge what we can, address what we can, but continue to have empathy for the situation and be non-judgmental. All right, so now we're going to go back to those levels again of that bell curve. So this level 1, that's this baseline level of arousal, so our calm state. This is where we want to teach strategies. Again, those replacement skills from the social, emotional, behavioral section of our IEP. We want to be practicing and putting into place effective antecedent strategies as part of our normal routine. So the first one here, and this one you guys are going to hear me say over and over and over and over and over again, we want to be establishing systems of reinforcement. So we're going to be establishing what motivates our students and establishing those systems of reinforcement. So that might look like spending time pairing, conducting preference assessments, making sure that they have functional communication so they can ask us for what they want and what they like, as well as sometimes having rule cards and token boards. And again, this is level 1. This is where we're establishing these things as part of our normal routine, which means that if we have a rule card or a token board in place, that rule card or token board shouldn't be used sometimes. It shouldn't be used only by certain people. It should be used consistently across the school day as part of that student's normal routine across everybody. So in the past, I've heard comments like, oh, they started having a hard time, so then I took out the penny board. The penny board or the token board shouldn't be a consequence to a challenging behavior. An antecedent strategy is something that is status quo. It's used across the board at all times. So it's something that's there to help them be successful. Does that mean that if a learner has a token board introduced at age 3, that they're still going to have that token board at age 21? Not necessarily. But what should be done is that token board should be systematically faded or systematically modified based on that learner's needs. So it shouldn't be on Monday we use the token board, but on Tuesday we decide, oh, he had such a great day. Monday he doesn't need it anymore. It needs to be systematically faded. So it's not something that should be taken out as a consequence to a challenging behavior. It should be used as an antecedent strategy, which means that we start off with the token board available, start off with those systems of reinforcement available. The next great antecedent strategy is building behavioral momentum. So this means that we might start our learners off with things that are a little bit easy. So mastered items, maintenance tasks, previously learned lessons, a review. And we might, if we're able to, intersperse those tasks throughout the learning session, so that we don't just start off something easy and we're hard the whole time. We want to have that balance. Make sure that our learners, when they are working on a really difficult skill, that they still have some opportunities to work on something easier so that they're meeting with success. So if our learners are staying successful, we might see fewer challenging behaviors because they're still regularly meeting with success. Oh, I went backwards by accident. I'm sorry, everybody. This next part, communication, has a lot of great factors in it. But I want to talk about the ethics of communication for just a quick second. So it is so important that our learners always have their mode of communication with them. So remember, all behavior is a form of communication, those desirable behaviors and those undesirable behaviors. So for most of us, we communicate vocally using our vocal cords, and we don't have to think about it. They come with us wherever we go. If we have a learner that uses sign language, their hands also, we don't have to think about it. They go with them wherever they go. But if we have some learners that use an augmentative device, whether it be an iPad, another electronic, a tablet, a textbook, those devices don't just automatically go with them. And in a training that I attended with Andy Bondi, who is the creator of the PEC system, along with his wife, who's a speech language pathologist. Andy Bondi is a behavior analyst. He made an analogy where he equated not giving a child access to their textbook, because that's what he was specifically talking about at the time, but it could be, again, any augmentative. It would be the same as taking a person who communicates vocally and taping their mouth shut, or taking someone that communicates with sign and tying their hands behind their back. Ethically, it was pretty much the same thing. So if we have a learner that uses an augmentative device, again, whether it's an electronic or low-tech device like a textbook, and we're maybe putting the device in a drawer, or we don't take it with us to gym or another elective, we're effectively taking away their communication, and we're putting tape over their mouth or tying their hands. And we might see an increase in problem behaviors at those times, because if they can't communicate in an appropriate way, they're going to have to use other methods in order to communicate. All behavior is communication. So it's so important that we make sure that whatever modality that student uses to communicate, that it is always with them and it's always available within arm's reach. Another antecedent strategy is to set clear expectations. So the first little bullet here, there's going to be some examples on the next slide, but just a little tidbit that we should phrase expectations as to an observable behavior that the learner should do. Sometimes we might just assume that the learner knows what behavior we're talking about. So if I say, don't stand on the chair, we might all be assuming that the learner knows that don't stand on the chair means I should sit in the chair. However, not all of our learners do know that. We also have some learners, especially if we're starting to go up that bell curve, we might have some learners that, are in that refusal stage, that silly stage, where they might hear, don't stand on the chair, and guess what? Maybe they're going to stand on the table. And technically, I didn't tell them not to stand on the table. I just told them not to stand on the chair. So by being very clear in my expectation and telling the child what they should do, now we both know what I'm expecting. I also really encourage everybody to phrase things positively. Where I can, I do avoid things like not and no where I can. So by having that positive phrasing of it, telling them what they should do, I feel that it just has a better connotation when we're interacting with our students. I also, again, now it's very clear to both of us what the exact expectation is. We also want to make sure that we're using language that the student understands. We might want to provide a model or a visual cue as necessary. Again, on the next slide, one of the examples is pay attention. What if our learner doesn't understand that vocabulary term? What if they don't know what attention means? How do we define attention? So maybe using a gesture towards the teacher, or just saying, look at the teacher. That's much clearer of an expectation, and it might be vocabulary the student understands better. Also, less is more. We want to, talk less where we can. A lot of our learners have difficulties with auditory processing, so we want to make sure that we're clear, concise. We don't need to give a full paragraph or a multi-step direction if we could have said it in 3 to 5 words. And this next part is just, again, a little tidbit to set yourself and your student up for success. Phrase your expectations as a statement and not a question. So again, we might be having learners who are able to answer yes/no questions. And if we ask a question, we're really giving our learner a choice. So if something is a choice, absolutely provide that choice. It's going to be another antecedent strategy in a couple of slides. But if something is not a choice, if it's sit in your chair, it should not be phrased as a question. Can you sit in your chair? Because what if a learner says no? You did ask the question. So you're not setting yourself or the learner up for success at that point. So it should be phrased, again, as a statement. So sit in your chair instead of can you sit in your chair? That gets you talking less. It has you setting it as what they should be doing. Again, statement, not a question. So here's those examples. I went through most of these already. And once we set those clear expectations, we set ourselves up for lots of opportunities to provide reinforcement. So we can catch them being good. And it's also important to be consistent. Reinforce when the expectations are followed. Don't reinforce when they're not. And establishing instructional control and setting clear expectations does not involve reprimanding, does not involve aversive consequences. Again, set those expectations, phrase them positively, and provide lots of reinforcement when you catch your students following those expectations. Another great antecedent strategy is to provide choices. So it gives the student a feeling of control. And again, if we think about ethics, all of us have so many choices that we're able to make within our day. What we wear, where we go first, if we stop for coffee, if we don't stop for coffee, if we drink coffee or tea. And just like we have choices, our students should have choices. Remember, we want to be treating everybody with dignity and respect. And so part of that is having some choices. There might be certain things within the day that are choices for our students, and there's certain things that aren't. In the high school, there's the schedule is the schedule, but we might be able to provide choices within different activities. So maybe it's math time and there's no choice about it being math time, but I can choose, do I use the red pencil or do I use the yellow pencil? Do I do problem number 3 first or do I do problem number 1 first? So choices within the activity that might not affect your lesson, but will give that learner a feeling of control over their day. And some of us might be able to have a flexibility within our schedules to give choices between activities as well. So do you want to do, reading first, or do you want to do math first? Do you want to do a writing activity first, or do you want to do a daily living task like setting the table? I also really suggest showing the choice. Some of our learners don't have the skill of being able to answer yes or no questions. So do you want water? Some of our learners might not have the skill of answering that accurately yet. Some of our learners also, if we give a vocal choice or an auditory choice, a lot of our learners repeat the last thing that we said very often. So if I say, do you want the big water bottle or the little water bottle? They might say little water bottle because it's the last thing I said. So I always encourage people holding the items up. This is called a paired choice or a forced choice, and saying pick one. And you might get a more accurate choice using that strategy. And again, this is when we're teaching those replacement skills. And these replacement skills should be paired with the function of the behavior, which might have required a formal FBA, might just be based on your observations. So functional communication skills. So if a student is engaging in behavior to avoid or escape a task, teaching them how to ask for a break. If they're engaging in behavior for attention, teaching them how to ask for that. Teaching them how to ask for tangibles or edibles, items that they want. Teaching them how to ask when something is occurring. Maybe behaviors are occurring because students really, really want to go to gym. So let's ask them how to ask, or teach them how to ask, when is gym? Teach them how to read a schedule. I recommend practicing these skills on a fixed time schedule. Again, this is still at level 1 in our bell curve, on our baseline level of arousal. So there's not necessarily going to be opportunities that our student is demonstrating behaviors that they would need to ask for a break. But we should be practicing it because at this level 1, this is when they're at that level of arousal that they're going to best be able to learn from us, and we're going to be able to most effectively teach. So if every 20 minutes I have a timer goes off, that indicates to me, okay, it's time to practice asking for a break. So the timer goes off, we practice asking for a break, the student goes and takes a break. Now they've been able to pair that skill. So when I say I want a break, I get to go to this break area and I get to chill out for a little bit. Or maybe when I say I need a break, the worksheet goes away for a little bit. And so later on, when they're at those heightened levels of arousal, because they've had that repetitive practice practicing that skill, sorry for that redundancy of terms, they're more likely to demonstrate that skill as they get to those more heightened levels of arousal. Other skills that we might be practicing here might include deep breathing, relaxation. So maybe when you're like tightening and then relaxing, maybe doing certain stretches or yoga. And we might be teaching here using modeling the techniques ourselves, role playing them out. So this might be some social skills training here. But again, this should be done at that level 1. And I'm also going to be sharing out with everybody 3 different Google Slides where some of these replacement skills, I have them out in different ways that you can teach them. So now we're getting to level 2. So we're going up that bell curve. Maybe we're at that anxiety level here. And this is where we might need to prompt, or maybe some of our learners will be able to independently demonstrate some of those previously learned strategies. So this might be where we'd be looking for them in the moment to ask for that break. So we're starting to see maybe some of that pacing, maybe some of that, rustling of the paper. So this is where we would prompt them to ask for a break, because this is when they need it and it would help them to de-escalate. We might want to practice our deep breathing or relaxation techniques at this point. We might need to redirect to a different activity or neutral task. So again, it might be necessary for us to have our learner meet with some success. A lot of times I recommend here using discrete close-ended tasks, so something that has a clear beginning and an end. And sometimes we might have to use other strategies to create or to turn an open-ended task into something very discrete. So maybe it would say, if we're doing a worksheet, we take a timer and we say, okay, we have 1 minute left. When the timer goes off, this is done, regardless of the level of completion. We also might want to go back to that level 1 antecedent strategy of building behavioral momentum using easier mastered skills so that our students start meeting more success, and we're building that up. So it's like a snowball rolling down a hill, building up, building up, building up, and we're using that momentum to get us back to being able to complete harder tasks. You might use visuals. Remember, at this point, our learners are going to be able to process less and less, so we want to minimize that need for auditory processing. Talk less, one-step directions, clear and concise. Maybe we're going to be using first then cards, which are also going to be included in the Google Slides that I'm sending to you guys. You might just provide a gesture, model different behaviors, so using some visuals. And all of these things don't require something printed out and fancy and laminated. You could take just a piece of scrap paper if you need to turn a skill into something discrete. And so if I say, okay, we have, this, we're doing our work, we have to do 5 things, and then we're done. Saying that to a learner, for many of our learners, is too much. Again, we're minimizing that need for auditory processing. But if I take a piece of scrap paper and I make 5 check boxes, and when we check off those 5 things, it's all done, that simple visual that I made in the moment might be enough to be able to redirect and refocus and make, again, that task discrete. There's a clear end to it. So a lot of times if our learner says, oh my gosh, there's no end to this in sight, I don't know when I'm going to be done, just turning it into a discrete task can help our learners feel a little bit more in control, help them understand what's going on. So once we're hitting that level 3, now we're in that defensive level from the CPI crisis development model. We want to, again, minimize speech, minimize that need for auditory processing, talk less, use gestures, use visual cues, take some deep breaths yourself, model them for your student, model staying calm, watch your nonverbal cues. Remember that stance. Remember looking non-confrontational. Use a calm, quiet voice. So this is not a time to yell at our students. If that's not appropriate, if we escalate, our learner's going to escalate. But we also don't want to be too calm because our learner might try to counter that if we're too calm. So I just use clear, calm, quiet. Remember, self-monitor. We don't want to escalate. We have to remain calm and professional. In a lot of our classrooms, we might have a designated break area, so it might be necessary at this point to separate the student from the trigger, give them a safe place to calm down. I might have a beanbag or other calming activities. Something also extremely important here, we should never not be visually attending our students. That's extremely important in safety. You should always be visually attending to the students that you are assigned to. But here, when we're at a level 3 or that defensive level, we should be visually monitoring our students. So they might need a break. We might need to give them some space, we should still be able to see them so that we can quickly intervene if possible to keep our students safe, because this might be that level that they might begin engaging in aggression or self-injurious behavior. So again, give them space, but don't leave them visually unattended. This might be an appropriate strategy, walk, don't talk, for some of our students that do not have escape maintained behavior. If you have a student that's looking to escape from a situation, they would not be a student that walking would be a recommended strategy. But if you have a student that does not have escape maintained behavior, taking a walk at this time, practicing asking for it first, but taking a walk might be a great strategy to diffuse the situation. This wouldn't necessarily be a time to discuss the incident. This would just be a little change in scenery, get the blood flowing, try to, again, separate the student from the trigger and redirect and refocus. I just want to very, very super quickly, because we're out of time, talk about prompts versus crisis. So prompts are ways in which we help a student to do a task or activity or follow through with an expectation. So prompts are a teaching strategy, but we can also use them to keep our students safe. So if we have a student that might be, beginning to engage in some self-injurious behavior, and we prompt their hand down, that's a prompt. That's not CPI, that's not a restrictive intervention, that's a prompt. We're keeping them safe. If we're giving our student physical hand-over-hand guidance to wash their hands, that's a teaching strategy. We're guiding them on how to complete that task. That's a prompt. Crisis might be when we're starting to use more defensive techniques. And when we're doing any type of prompting and any type of other crisis intervention techniques, we need to be very careful of self-monitoring and using equal and opposite pressure. So, sometimes when we're providing prompts, we might be, we're supposed to, in some hand-over-hand guidance, have full physical contact with the student, but we just want to be mindful of the pressure that we're providing. I oftentimes would almost just use my fingertips, and it did take a lot of practice to be using a light touch while still being errorless and not allowing the student to make errors in the teaching process, but providing that light touch or even an open hand so there's space in between the learner and my hand. So I'm doing that light touch and making sure that, when we are providing certain prompts, that we are not restricting that freedom of movement. So if we are, let's say, a learner sitting in their chair and we have our hands over them and we're not lifting our hands up and we have full contact and we are partially or fully restricting their freedom of movement, that could be considered restrictive intervention. So even though maybe our intention was to provide a prompt, we are bordering on that level of crisis intervention. And so we want to make sure, again, that we're self-monitoring. So every now and then it's really important to take that step back and look at some of the prompts that we're providing. So remembering that for a restrictive intervention to be warranted and necessary, the learner must meet criteria. They must be causing clear physical harm to themselves or clear physical harm to others, or engaging in property destruction that could cause physical harm to themselves or others. If they do not meet those criteria, restrictive intervention is not warranted, and it would be not really ethical of us to do so. So just again, some reminders here. Best practice antecedent strategies should be part of our daily normal routine. They should be in place all of the time. They should be the status quo. We should also be fluent in teaching calming strategies and implementing de-escalation techniques. Again, I'm going to be sending everybody out some Google slides with some of that info. De-escalation is the first thing that we should be doing when the harmful behaviors recur, so not those non-restrictive interventions. Then we might have to do some blocks releases to keep ourselves and our students safe. And that final step, it should not be the first thing that we jump to. That final step is that restrictive intervention, which again, we did not touch on today. Those will also be those physical techniques within CPI. They should only be implemented when criteria are met. They should only be implemented by CPI trained staff. And so if you're not a CPI trained staff member and you think that a student is meeting criteria for those restrictive interventions, you should be calling a behavior specialist. You don't need to call a behavior specialist to implement some of these other calming strategies or de-escalation techniques. And if a restrictive intervention is implemented, it must be reported immediately. The student must be observed by the nurse. The nurse has a part of that documentation that she fills out, and then that document needs to be sent home to the family as well as shared with the team here within 24 hours. So again, Restrictive intervention is the last thing that we would go to. And if we do implement it, it must be done by a CPI trained staff member, and it must be documented and shared right away. With that being said, I hope that you guys enjoyed the training. Again, all of these are techniques that could be used right away in your classrooms. Some of the Google slides will be coming, or all of the Google slides will be coming out shortly. Next week is a training that is specific for classrooms that are utilizing the ACE system, which is being used in specific MD classrooms. The training will be on data collection. And then the following week, which is March 29th, we'll be getting ready to gear up Autism Awareness and Acceptance Month. So March 29th, I hope to see all of you back for that training about autism. And the April trainings, you guys will be getting information about that shortly. So thank you all so much for joining me today. I hope it was helpful, and have a great afternoon. Bye.